The topic I decided to do was RCW 69.50.315, medical assistance, drug-related overdose, and prosecution for possession. I want to give you the basic background of RCW 69.50315. It's an enactment law that was passed in 2010. The purpose was primarily to encourage individuals to seek medical assistance during a drug-related overdose without the fear of being prosecuted for drug possession like there was before this law was passed. Key provisions. This law gives immunity for overdose victims and bystanders. Overdose victims and bystanders who seek medical assistance in good faith during an overdose event are protected from prosecution for drug possession, provided the evidence for the charge was obtained as a result of seeking assistance. Protection for those needing medical assistance. Individuals experiencing a drug-related overdose and needing medical help are also protected from prosecution for possession if the evidence was obtained due to the overdose and the need for medical assistance. Now, that was an explanation of what I'm about to read to you in easier terms to understand. This is the actual law, the way it is written in the RCW in Washington law. So RCW 69.50.315 says medical assistance, drug-related overdose, and prosecution for possession. Subset 1, a person acting in good faith who seeks medical assistance for someone experiencing a drug-related overdose shall not be charged or prosecuted for possession of a controlled substance pursuant to RCW 69.50.4013. Also, it states that they will not be penalized under RCW 69.50.4014 if the evidence for the charge of possession of a controlled substance, if it was obtained as a result of the person seeking medical assistance, then they will not be charged criminally. Now, subset 2 of the same law states a person who experiences a drug-related overdose and is in need of medical assistance shall not be charged or prosecuted for possession of a controlled substance. This is pursuant to RCW 69.50.4013, and I got this off of the website, the RCW website, or penalized under RCW 69.50.4014 if the evidence for the charge of a possession of a controlled substance was obtained as a result of the overdose and the need for medical assistance. And then also the protection in this subsection is from prosecution for possession crimes under RCW 69.50.4013. It shall not be grounds for suppression of evidence in other criminal charges, which is pretty major. It can't be used in other charges, and that could be a barrier prior to people seeking help and not calling the police and then potentially not making it through an overdose. There was another section on this law. It was a note section. This is underneath the initial thing I read. It says that the intent of this law in 2010 was because the legislator intended to save lives by increasing timely medical attention to drug overdose victims through the establishment of limited immunity from prosecution for people who seek medical assistance in a drug overdose situation. Because drug overdose is the leading cause of unintentional injury death in Washington state. It is ahead of motor vehicle related deaths. Washington state is one of 16 states in which drug overdoses cause more deaths than traffic accidents. Drug overdoses mortality rates have increased significantly since the 1990s, according to the Center for Disease Control and Prevention. An illegal and prescription drug overdose killed more than 38,000 people nationwide in 2006, the last year from which data is available. The Washington State Department of Health reports that in 1999, unintentional drug poisoning was responsible for 403 deaths in this state alone. And in 2007, the number has increased to 761, compared to 610 motor vehicle-related deaths. So pretty substantial. Since 2012, when the THN, which is Take Home Narcan program, began, there has been a lot of growth of these programs across the states. Based on data through 2015, deaths from heroin in King County have decreased for the first time in the last 7 years. Also, the number of people seeking treatment for heroin addiction has increased. I know in a lot of nonprofits, if not all, in King County, Narcan is available, as well in a lot of clinics and medical places for medical care, as well as street outreach. So the take-home Narcan program can be successfully implemented into community pharmacies, or like I was saying, community-based mental health, to increase access and awareness of opioid overdose recognition and response. Washington State's 911 Good Samaritan Overdose Law, which is RCW 69.50315, protects against drug possession charges. This was an article I saw on stopoverdose.org. If you seek medical attention in drug-related overdose, you cannot be prosecuted for drug possession. The overdose victim is also protected from the charges. I wanted to compare our laws in Washington to 2 other states. One of the states I picked was California. California has a Good Samaritan law. It's called AB 472. It's designed to encourage people to seek emergency medical assistance in cases of drug overdose without fear of arrest or prosecution, but this is only for low-level drug offenses. It has a lot more limitations than Washington. The Good Samaritan law does not provide protection for those on probation or parole. It still may constitute a violation. It doesn't apply to individuals possessing quantities of drugs that suggest trafficking or sales, and other unrelated crimes such as trespassing or drug driving may still be charged. SB 250 expansion. The Senate Bill 250 expanded California's Good Samaritan law to include protection for individuals who self-reported fentanyl poisoning or opioid overdoses through the use of fentanyl testing strips or health-monitored devices like smartwatches. It also provides immunity for reporting substances testing positive for fentanyl to law enforcement. New York is the next state I wanted to compare. Everyone, regardless of age, who seeks medical help for themselves or someone else during an overdose, the person who has overdosed, the law protects from charges and prosecutions, but the law does not protect from the following: possessing controlled substances up to and including A2 felony offenses. That would be anything under 8 ounces. Possessing alcohol where underage drinking is involved. Possessing marijuana, and I was surprised, any quantity of marijuana. Way different in New York. Possessing drug paraphernalia and sharing needles. That's also different. A1 felony possession of a controlled substance, 8 ounces or more. Sell or intent to sell controlled substances, and open warrants for your arrest or violations of probation or parole. They're not going to protect you against. So I wanted to just note the difference in those 2 other states as compared to Washington. Washington definitely being the most lenient, and why this is relevant as a therapist. I feel this policy is relevant to know as a therapist because we're going to be dealing with various people from various backgrounds, and we already are. We need to know how to deal with addiction-related topics empathetically and knowledgeably. We need to understand that not everybody is going to want to go to treatment, and understand harm reduction and keep updated on the current laws as well as articles, and trying to better understand what our clients might be dealing with. I wanted to notate in marginalized populations to be multiculturally sensitive. There's a lot of systemic barriers. These populations are protected under this policy because they're usually targeted for drug-related crimes. This policy protects them if they see someone under the influence, if they're under the influence, or if they reach out for medical help. and fear of being arrested. Marginalized communities could still be a little bit uneasy about this. This law is made to protect them, but it claims to protect them, but it could be intimidating for some. Sometimes in neighborhoods, the police do not follow what they should be following, and the law in this case, and it could have a rebound effect from protecting the very people it was made to protect. That's especially true if the person with substance abuse concerns or mental illness concerns does not believe that their police in their neighborhood are going to treat them fairly and follow this. So I just wanted to mention that, to keep that in mind, that even though it's supposed to protect vulnerable populations, it still has a lot of flaws. Thank you.